Welcome to Afternoon Tea with Docs. I'm Dr. Linda, emergency and lifestyle medicine physician, tuning in here from Sheffield. And if you are new to us, well, this show is live every Sunday at 5 p.m. UK time, bringing you world-renowned experts like our guest today, Dr. Nitu Bajekal, to bust medical misinformation and share practical, evidence-based lifestyle advice that you can implement right away to help you prevent, treat, and reverse chronic diseases in a supportive community setting. After the interview, if you joined us on Zoom, you will be able to speak to us on our guest expert off recording so that you can ask your burning questions. If you're tuning in live, do let us know where you're from and what are your interests in lifestyle medicine and gaining health. So a little bit about Dr. Nitu Bajekal. First of all, she and her amazing daughter, Rohini Bajekal, are authors of Living PCOS Free, and it is now available for pre-order. The links are below. Dr. Nitu Bajekal is a senior consultant in the UK, over 35 years of clinical experience. She's a fellow of the Royal College and recipient of the Indian President's Gold Medal. She is one of the first US board certified lifestyle medicine physicians in the UK. She has written the Women's Health module for the first UK university-based plant-based nutrition course. She is the founder of Women for Women's Health, a voluntary service set up to educate, energize, and empower women to make lifestyle choices to help improve their own and their family's health. Dr. Bajekal is a passionate educator for women, providing reliable medical and lifestyle information from the general public, doctors, workplaces, and schools. She is a committed vegan, personally benefiting from this lifestyle. And we cannot wait to share today's topic with you, which is on menopause, how to optimize it with lifestyle and with nutrition. Thank you so much for joining on this very busy Sunday, Dr. Nitu Bajekal. And I know you are having a very important event today, and you still took this time out to educate the public. So thank you so much.
Thank you, Linda. Can I just say that I'm so grateful to be invited. I'm just always so impressed with young doctors who are taking the time on a weekend, Sunday after Sunday after Sunday, to do this kind of work. And we were just talking off air a little while back, and just to say that most doctors, especially doctors like you, are so important in the whole scheme of things, because if we can help even one person improve their health, then we have really done our job. And that's really important. The message I want to say is that do support Afternoon Tea for Docs, do spread the message, do forward information so that people join, because you never know which one of your friends, which one of your family, which one of your loved ones will actually benefit for one word information so that people join. I think there may be, is there echoing, Linda, or is it okay?
It has been corrected now.
Okay, fine. And so I just want to say that one should be very aware that you may not know from looking at somebody what they're going through. And so without judgment, if you can share information, then that is something that can really help. So thank you for your lovely introduction. Yes, we are very excited. I love what I do. I find Obs and Gynae just as thrilling as I did 35 years ago when I first started. But I have to say, over time, I realized that there was a little bit more that I needed to bring to my patients, a little bit more in my toolbox that I needed. So thank you, Linda, and thank you to everybody who's tuning in. It's Sunday, it's Halloween, so be prepared for my dogs to start barking if the door goes.
Thank you so much for your support. And definitely it is about changing one life at a time. And that, as we say, if you throw a pebble into the lake, then it starts its ripples, and we hope that through these talks we can achieve that. So today we are talking about menopause and optimizing menopause with lifestyle and nutrition. let's start with what is menopause, if we can define that.
Okay, so menopause is a stage of life. It's a phase of life. So people often think, oh, I finished menopause. It is not exactly that. If you think about it, we start periods around the age of 12, anywhere between 10 and 16 are the worldwide averages, but most people in developed countries start their periods around the age of about 12, between 12 and 13. And you have periods if you are not having children, or depends on the number of children you have, what hormonal contraception you take, you are having anywhere between 350 to 500 periods in your lifetime. And then around between the ages of 45 and 55, the eggs that you're born with, you're already born with a number of eggs in the ovaries, and they start to deplete. When they reach below a critical level, when your periods stop for more than 12 months and there's no other cause attributed to that, so no periods for more than 12 months because of ovarian follicular depletion or the egg count dropping, that is known as menopause. So that is menopause, and after that is post-menopause. And the important fact that we have to understand is that the average life expectancy in developed countries, or in higher income countries rather than developed countries, not a good term, is that people who menstruate, who stop menstruating will be alive for another 30 years. So the average age of menopause is 51 all over the world. Is pretty much similar, but between 45 and 55 is the range. And then the average life expectancy is anywhere between 83 years to 88 years. I think Hong Kong and Japan and all have 88 years. So that's a lot of years that you're going to spend when you are in this phase. And so it has been previously neglected because most women did not survive. They lived till 35, 40. They started their periods at the age of 10 or 12 or 14. They would have a baby straight away. They would be pregnant for 9 months, nursing for another 2, 3, 4 years, and then have another baby if they were lucky enough to be alive. Most people died in childbirth. So they probably had about 10 or 12 periods. And if they were lucky to be alive, they lived till 40, 45 in good situations about 150 years ago, except the occasional people. So now we are living all these extra years in the phase called menopause. So the average age is 51, the range is 45 to 55, no periods for 12 months. But Linda, I want to highlight the perimenopause. So the perimenopause is an important stage that can last anywhere between 2 to 8 years. And that is the time that can start 2 to 8 years before you actually stop your period. So you can imagine it may be in your late 30s if your period is you're destined to stop your period at the age of 45, for example. So, and this period between lasting anywhere between 2 to 8 years, you can have hormonal fluctuations, you can have menstrual irregularities, you may have frequent periods, you may have mood swings, you may have months where you're fine and then months when you're not fine, and you're thinking what's actually happening. And often during this time you may be somebody who hasn't completed their family, or you may wish to start a family, or you may be part of the sandwich generation where you are finding that your children are growing up and are teenagers, or your parents are getting older, and when you hit menopause that becomes even harder. Relationships might become more difficult because you're not feeling like having sex, or your vagina is drier, so atrophic changes. So perimenopause is a time before actually you stop your periods, and that can be very variable, anywhere between 2 to 8 years. So that is important because that gets neglected and doesn't be talked about. So it's menopause in transition, as your ovaries are starting to lose the eggs. So you're born with, I think when you're conceived, you may have 500,000 eggs, I think, and by the time you are born, you have several 100,000 eggs, and every month a lot of eggs get lost naturally. Okay, you can't make any more new eggs, but when those eggs actually drop below a critical level, that's when menopause is. And for the average age that I told you is 51, with the range between 45 and 55. But there are people like me who actually stop their periods under the age of 40. I actually stopped my periods at 38. So I belong to the small group of 1 in 100 people who stop their periods under the age of 40, and is known as premature ovarian failure. And despite being a doctor, despite being, I was applying for consultant jobs, I thought it was stress. I thought because I was being bullied, because I was so busy working 100-hour weeks, I couldn't understand what was happening to me. There was no family history, and I didn't know where to turn for lifestyle changes. And it took me another 10 years before I actually found that what I had adopted because of my 9-year-old decided to go vegan, that, in those days, there was no vegan pizzas and no vegan cakes. So I had to do everything myself. So I was eating a whole food plant-based diet. And I found a lot of significant relief, but I didn't put 2 and 2 together. I did not realize that what I had started to eat was the reason why my hot flushes improved or my panic attacks improved. It doesn't help everybody. I should have really gone on HRT, but it was a time when HRT was not really very popular. There was a lot of confusion. I didn't know where to turn. And basically, I didn't have the time. I had young children, a dog, a very busy career, and I was, trying to head to the top. So, moral of the story is look after yourself. Self-care is really important, really, really important. So I hope I've explained it in a long way what menopause is.
No, absolutely. I would love to know if you're talking about premenopause or menopause, it is a certain time in your life that you start having that. But when we're talking about prevention for the side effects of either, is it important that we start learning about lifestyle nutrition changes early, even at puberty, or even younger than
even
that,
in the uterus? So
even in
how
the
your grandparents and how your mother's nutrition has been will affect, that's known as epigenetics. So epigenetics are the way the genes that you're born with are expressed. And so we know that from people who've been in starvation areas, in famines, we know how it manifests. So we know that the earlier you can make the change, then the better it is. Because, simple example, just to give you, that we know that there are studies to suggest that children who eat soya beans, soya milk, and tofu and things earlier in childhood reduce their risk of prostate cancer and breast cancer in adult life. The same thing stands for menopause. The earlier, you're never too early to start preparing for different different life phases of your life. And because it's the same diet, the diet that prevents menopausal symptoms, and there are about 34 different menopausal symptoms, but the most common is hot flushes, or hot flashes as it's known in the US. 85% of women, and when I say women, Linda, I want to again clarify, we are talking about anybody who's assigned female at birth. So I don't want to exclude women who identify as women, but I also want to include people who have got a reproductive system, who actually are assigned female at birth and identify now as, different groups, non-binary or transgender. So that's quite important because, marginalized groups often don't get a voice. And it's important that when I'm saying a lot of these things, I'm trying to explain that, it involves everybody who wants to be included in this group. So we know that 85% of women or those assigned female at birth will suffer from hot flushes in a higher income country, while you will have only 10% in China, 17% in Singapore will suffer from hot flushes. And there are several reasons for that. Because our diets, a typical Western diet, tends to have more saturated fat. Read that as more animal products. They tend to carry more weight. So we tend to be 75%, 74% in the UK. Women are either carrying excess weight, so overweight or obese, the medical terms that we use. And so we know when you do that, you suffer more from hot flushes because the hypothalamic, the trigger zones basically cannot adapt to the temperature. And so you actually, even though you have more estrogen floating around on your body, even though you have more body fat, you conversely end up having more hot flushes. So higher saturated fat, higher BMI in that higher body fat. Some races, so we know black women can actually suffer more from hot flushes, probably because of, again, of the socioeconomic and the health inequalities that we know. We know that those who eat more vegetables and more fruit and who are of lower BMI tend to have fewer symptoms. So generally, we know Southeast Asian women who, when they live in China or in Singapore and things previously, not now so much, because their diet contains soya, their diet contains lots of green vegetables, lots of whole grains and beans, they tend to suffer much less from, and there are studies after studies to show that those who eat ultra processed foods, snacks, fatty oils, or fatty snacks, and animal foods actually have worse menopausal symptoms, while surveys, when they look at vegans, they have less bothersome symptoms. Now, vegans now may be looking quite different from vegans, say 20 years ago or 25 years ago. But, most people, they start eating, they're happy to eat some animal derivative like alternatives, but soon they realize that eating the whole plant food is actually much more enjoyable and much more, but you have those as treats. So yes.
Dr. Bajekal, when we talk about obesity, there is always this question, why are obese women more affected? What is adipose tissue and what does it release? Can you explain that?
Yes. So basically, what happens is when you carry excess weight, most of that weight is trapped within your cells. Okay. And remember that estrogen, progesterone, and testosterone are the three main sex hormones. Testosterone belongs to androgen group, but all these three sex hormones are produced from the same steroid pathway. They're all produced by cholesterol, and cholesterol, your liver makes enough cholesterol. You don't need to eat cholesterol to make these sex hormones. So cholesterol is the building block. Progesterone is the first. It's a very complex pathway, but I'm just going to simplify it. Progesterone, imagine progesterone, that then gets broken down to androgens, and then androgens get broken down to estrogens. So without testosterone, there is no estrogen. So men and women and all genders produce estrogen, progesterone, and testosterone. You just produce it in differing amounts in different stages of your life, whether you're a man or a woman, or however you identify. So you may have higher levels of estrogen, or a particular type of estrogen, such as estrone, estriol, and estradiol. Estradiol is in reproductive age group. Estriol is in pregnant women. Estrone is mostly seen in menopausal women. But these fatty, so the fat then starts producing more androgens, more estrogen. And when you have excess amount of estrogen, then what basically ends up happening is starts fueling your fibroids, your endometriosis. But as I said, although you have these high levels of estrogen floating around in your body, the body fat sort of behaves like an insulator and does not allow the hypothalamic zone to respond to the temperature regulation. So the thermal regulatory system gets a little bit altered. And so we don't know for certain why hot flushes occur, but we think that that is one of the reasons why many of the menopausal symptoms occur, is because of this increased amount of adiposity within the cells that cannot actually go. Then the second thing is that when you have these high levels of intracellular fat, not only is it producing unwanted excess estrogen, which then has a bad effect on your breasts, so increasing your risk if you're a woman, or for breast cancer, for a man, for prostate cancer. So it also increases your risk of insulin resistance, because insulin's job from the pancreas is to basically push the glucose into your cells. But when there's a lot of fat blocking those receptors, it can't do the job. So the insulin levels increase in your pancreas. And so as a result, the insulin levels keep increasing, and that has a perverse effect. So it then works on the adrenal glands, on your fat cells, and on your ovaries to produce even more androgens. So then you start having increased amounts of chin hair and facial and excess hair that you see in polycystic ovarian syndrome, you see in menopause. So it's very complex, this whole thing, but it all boils down to, the same thing. You're trying to essentially get rid of this excess estrogen that is there when you're carrying excess weight, and fiber is a great way to get rid of this excess estrogen, because estrogen, when it's in excess, it gets excreted into the gut. But if you don't have fiber to trap that estrogen and for you to excrete it out, what happens is the liver, the enterohepatic circulation, it gets absorbed back into the body through the liver, and it's a vicious circle. So that is why carrying excess weight, and that's why even losing 5 to 10% of your weight can help you if you're not menopausal. So if you have polycystic ovarian syndrome, for example, and you can start noticing that your periods get regular, your acne improves. But when you're menopausal, losing even 5 to 10% of weight has shown in randomized trials, in smaller studies as well, that you can actually make a significant difference to your symptoms. The most common, as I said, was hot flashes. There are so many symptoms. There are about 34 symptoms described.
So adipose tissue increases your estrogen, and with that,
increases your insulin resistance, increases your oxidative stress. Because don't forget, when you carry excess body weight, then you're in a chronic state of low-grade grumbling inflammation. Okay, and inflammation is the building block for most chronic lifestyle diseases. So when you can reduce that inflammation by eating an anti-inflammatory diet, by doing healthy lifestyle behaviors, identifying stress, sleeping properly, you reduce your stress levels, you reduce your cortisol levels, you reduce your inflammation. When you reduce your inflammation, you by eating a lot of antioxidant rich, phytonutrient rich plants, then what basically happens is the inflammation reduces, the oxidative stress reduces. Oxidative stress is a situation where you have lots of free radicals floating around, and that causes tissue damage, that causes stiffening of your arteries. So again, as I say, there is nothing, when people say, what shall I eat for menopause? Is the same diet you would feed your child, is the same diet you would feed your partner, your teenage child, if you are pregnant, if you're wanting to nurse. Yes, there may be a few tweaks here and there, but essentially you want to eat a lot of legumes, a lot of green leafy vegetables, a lot of tubers, yam, tapioca, potatoes with skin, sweet potatoes, lots of fruit, lots of herbs, lots of spices. So these are all anti-cancer, anti-inflammatory, so they can actually make a difference. So you don't have to wait to start suffering. It's never too late to start, Linda. If you're somebody who's listening and you're 60 or 65, it's never too late to start, because you don't want to spend the last 20 years, especially of your life, not recognizing your loved ones. Dementia, 16.5%, so it's a top killer in the UK for women. Top killer. Dementia is the top killer. And heart disease affects twice the number of women as men. So in the UK, so we know that we present in a different way. We often reach accident and emergency, and people don't take our symptoms seriously. But twice as many women die from, more women die from heart disease, but twice as many women die from heart disease than breast cancer. And breast cancer is another. So if you want to prevent breast cancer, you want to avoid dementia, you want to avoid high blood pressure, carrying excess weight, menopausal symptoms, you want to be eating and living a life as much as possible. Not everybody can do 100%, but as much as possible. Any improvement to your current state. That's what I say.
We are about prevention. So can we make it clear to our audience that it is a whole food plant-based diet we are talking about, that is free of processed foods, free of animal products, which are very high on saturated fats, trans fats. And also for those mothers who want to help their children prevent disease, it is completely safe, and not only safe, but health promoting to start this diet even before they conceive a child.
Correct.
And then continue to feed their kids on a whole food plant-based diet without animal products is completely safe. And not only that, it's health promoting.
Yes. And just like any lifestyle or any diet, you want to plan it. Just because you think you're eating a plant-based diet, don't think that you don't have to think about what you feed your children, because you need to do the same whether you're on an omnivore diet, whatever. The reason why we are in this mess is because people are eating 60% of their foods are ultra processed, and there's a lot of processed meats, a lot of animal derived foods, but also a lot of refined carbohydrates. So with perimenopause and menopause, there's definitely a place for medication. Today, we won't talk about hormone replacement therapy, but there is certainly a place for women who need it. But at every step, lifestyle has to go hand in hand, because it reduces the risks of HRT, however small they may be, but also it may help you to live a much better life. So it's not just lifespan. No point living till 83 if you're not going to recognize your family, or you're going to have a difficult diagnosis. So you're much better off having health span rather than lifespan. And so eating a whole food plant-based diet. So a lot of fruits, the more fruits you eat, the lower the risk of getting diabetes. If you have diabetes, the more fruit you eat, lower the risk of getting the 3 top complications that fill our hospitals, which are basically kidney failure, blindness, and amputation. So you want to be eating a lot of fruit. If you eat 1 fruit in a day, make it 2. If you eat 2, make it 3. If you eat 3, make it 4. Slowly increase it over a period of a few months so that you're not feeling overwhelmed with any change that you bring in. That is my advice. Otherwise, it's easy to give up because people often cut out things without bringing in stuff. So it's really important that you crowd out all these foods that do not bring health, because animal foods have 0 fiber, ultra processed foods have 0 fiber. So try to bring in, look at what you're eating and see, what can I do? Can I make breakfast more interesting and palatable? So you may choose to have a big bowl of porridge with 1 or 2 tablespoons of flaxseed powder. Now, flax seeds have got lignans, which are a very healthy form of plant estrogen. And so we know that having a couple of tablespoons of flaxseed powder reduces hot flushes, but it also reduces breast cancer risk. You also want to add a cup of soya milk to that porridge oats. Porridge oats has got soluble fiber, it's got beta glucans, it helps to reduce your blood sugar levels. And the soya will give you the healthy plant estrogens, which work on the beta receptors of the estrogen rather than the mammalian estrogen, which comes from your body fat or from animal foods, which works on both alpha and beta. And the beauty about soya, for example, is that by doing that, it works to promote estrogen in some tissues and to suppress it at other times. So it will reduce your risk of breast cancer, but promote bone strength and reduce your risk of osteoporosis. It will help to reduce menopausal flushes, and it will help you to lose weight and have a slimmer waist, and it's heart healthy and doesn't have cholesterol. It has a lot of fiber, a lot of healthy protein, a lot of minerals and vitamins. So you want to have a breakfast with a big bowl of porridge oats with a cup of soya milk. Oat milk is fine, but doesn't have the same nutrition. Almond milk and all do not have any nutrition. They're better than dairy or cow milk, or goat milk, but it's not better than having soya milk. Soya is safe. Soya is healthy, whether you have thyroid problems, whether you have breast cancer. Eating soya 2 to 4 portions is particularly helpful for menopausal symptoms. So you want to start off your breakfast with lots of berries in it, banana in it, and things like that. You want to have a handful of tofu or tempeh a few times a week, and you must try to eat half a cup of edamame beans, because Dr. Neil Barnard's recent randomized trial has just shown that eating a handful of edamame beans, which are soya beans that are immature, you can get it from your local supermarket, frozen, just put it for your children, put it in your salad, have a half a cup, put some lemon or salt or pepper, and have it like little popcorn. You can have half a cup. It reduces hot flushes by moderate to severe hot flushes by 85%. That is absolutely fantastic. This was a trial done for about 12 weeks, small trial, but very significant. So I really, again, want to encourage people to eat these fruits, eat lots of vegetables, because vegetables and green leafy vegetables contain heart-healthy, blood vessel opening nitric oxide. So they basically allow your blood vessels to open up, which means that you reduce your risk of heart disease as well. You want to include intact whole grains, which means red rice, brown rice. You want to have black rice, wild rice. You want to have quinoa. You want to have amaranth, millet. You want to have brown pasta. You want to have basically, rye bread and stone ground bread and things like that, if you're going to have, so that you're trying to keep the processing as minimum so that the fiber is left in there. You want to have a lot of
basically everything that you listed that is not present in a whole food plant, in a Western diet.
Correct. Correct.
So thus we see the pandemic of chronic diseases shoot through.
Correct.
And you might have noticed that I wasn't very active on social media the last 2 weeks. And that's because emergency medicine in the UK, and I'm pretty sure everywhere in the world right now, is saturated with patients coming in with side effects of chronic diseases.
Absolutely.
In an emergency. And we are working day and night to try to pick up the pieces, but it's impossible. We are just
You're basically firefighting, which is
firefighting, exactly. And you know, our times are 10 to 13-hour waiting times is breaking our heart, but there's nothing we can do about it because the demand is so huge. And that is exactly because what you just mentioned, because we need to take care of our health at home. We need to make sure that we eat properly, real food, just like our grandma intended, in large quantities, lentils, legumes, beans, everything that is not in a Western diet. It's so sad to see that our patients are actually fed this in hospitals. They're fed this after I have resuscitated my patient after a heart attack. The food that has caused them to have a heart attack will be fed them right after.
But Linda, if you think about it, we were the same situation with cigarette smoking. You know, most doctors smoked, and so they would advise their patients to smoke slimline and things like that. So how, as a GP or as a gynecologist or as an emergency medicine doctor, if you're going to go home and a typical diet, a lot of my patients and a lot of my doctor friends will tell me, but I don't eat a lot of meat. What they do is their typical diet would be that they would have dairy milk, which is full of mammalian estrogen, pesticides, antibiotics, organic pollutants. Even if it's organic, persistent organic pollutant, even if it is organic milk, you know, it's meant for a baby calf. So when you're having, in the daytime, you're having that, or you're having muesli with yogurt or kefir or something like that, that's an animal product. Then for lunch, they think they're being very healthy. They'll have, a baked potato, but which is very good for you. But on top of that, instead of putting hummus and baked beans, what they're putting is cheese or tuna or cottage cheese, and almost always leaving the salad and not touching it. And they have a salad and they put again tuna in it instead of chickpeas and hummus. And then for dinner, they will usually have chicken, without the chicken skin, so that it's less leaner, less fat. Great, but and some vegetables. But 3 times a day, they're eating animal foods, and then they're having crisps and biscuits because it's lying around. So when you do that, you're missing the chance of eating. It's not that any food is bad for you, but every time you eat a piece of fish, every time you eat a piece, it's better for you than eating sausages. But every time you eat a piece of fish, you're missing the chance of eating a big minestrone soup with a nice chunk of sourdough bread. Every time you have egg omelette, you're missing the chance of having tofu scramble with avocado on toast, for example, or a big bowl of porridge. Every time you have chicken with some vegetables, you're missing the chance of having a tofu stir fry. So really, it's not about what you're eating, it's also about what you're not eating. And legumes or beans, green peas, soya, and lentils like dals are particularly helpful because they contain a lot of fiber that traps the excess estrogen and feeds the healthy gut bacteria in menopause. And so I always tell people, my patients, try to have at least 2 to 3 times a day some sort of legume, so that you're actually able, a big bowl of dal. People should look at your plate and think, who's coming for dinner? It should be so enjoyable and so full of color that everybody wants to have a bit.
And interesting that we mentioned a little bit today about chronic diseases, and within your family, just your family, and also in mine, you have used the whole food plant-based diet principle and lifestyle changes to address PCOS successfly, as well as type 2 diabetes and obesity, and your lovely husband, who is also in the NHS, an incredible doctor. He, and like all of us, had to learn this the hard way.
He had to learn the hard way, because I became vegan with our daughters about 20 years ago. And although he ate vegan food at home, whole food, plant-based food at home, most of the time as doctors and busy doctors with stress is also very important, but he was generally eating eggs and fish on a regular basis and tried every diet, kept on putting on the weight. There was a very strong family history of diabetes. And so as a result, he had become trying so many, he would see some improvement for a month or two and then things would happen. And he still didn't understand, and I didn't understand the power of food for many, many years. And so I knew this was healthy, but about 10 years ago, I started realizing how important it was. I just happened to be eating the right foods but not knowing why I was getting better, And so when Rajiv saw Forks Over Knives, that's when he decided to go plant-based. And for him, it was quite dramatic. Within 3 months, all his blood sugar parameters had improved so dramatically. His cholesterol was below, I don't know, around 4, from 8, it had dropped to 4. It was just magical, all the things that happened to him. And, over a period of a year and a half, he then lost about 4 stone, which is fantastic without really, he used to always look at me and say, how can you eat 3 baked potatoes? How can you eat so much of food? And I said, I don't know. Maybe it's my genes, because my parents were whole food plant-based, actually, completely. And they were ethical vegetarians and vegans, in the latter part of their lives, but they were always, we couldn't afford dairy, we couldn't afford oil, simply because my parents were academics with very busy jobs, but very limited pay.
What a blessing. What a blessing.
And
that
I used to
they
shout
couldn't
at my
afford.
mother. I used to shout at my mother, Linda, because I was very sporty, very athletic. And I used to get really cross with her because all these friends of mine who weren't very good at sports, I was competing at quite a good level, high level. And they would have a cereal with milk, and I would have chapatis and vegetables and salad, or in the morning, or I would have a lot of dal and things. And I was so angry with my mother because I used to say, they're having toast with butter, they're having milk, cereal with milk. And I really want to eat all that because I think it's going to be so good for me. And she said, look at you, you're the tallest in your group and you run the fastest, you've broken so many records. I think you're doing fine.
Unfortunately, the Western diet is made so cool through the movies, American movies, the American all breakfast, the American burgers, the meat, commercials and marketing is just fueling this. I want to be cool like them. I don't want to eat traditional food.
And I grew up,
really good
speaking English in India. I went to a convent school and then to a regular school, non-convent school. I used to listen to Neil Diamond and the Beatles and read, all the books that children read in this country, So as a result, 60 years ago, I just wanted to be like everybody else and eat all the foods. And here I was eating a whole food plant-based diet, walking everywhere because I couldn't afford, we didn't have a car, And yes, I think it did set me up for the rest of my life. Yes, I probably would have always developed premature ovarian failure. Maybe if I hadn't, there was no obvious cause. I don't know whether the stress of being an immigrant doctor, working such long hours, we didn't have the European, who knows?
The problem is that, we are shoved into medical school, and after medical school, we think that was the hard bit. Then we go into working hours and they go up to 120 and you're pushing for it, you're studying, and dairy is so easily accessible in hospitals, right? So eat a lot of that. We don't sleep at all. And I've seen it on myself. I went from a healthy 30-year-old to a chronically sick patient with colitis or recurring chest infections, 6, 7, lots of antibiotics. My periods were different at the time as well. So lifestyle has, in a medical training, is the worst that one can experience, really. So going on the right diets, sleeping well, changed so much. Got me off of medications.
Life is not a guarantee. So what happens is you will be thrown these things. You may get diabetes because of your genetics. You may get polycystic ovarian syndrome. You may get breast cancer. I understand that. But how we react to it, what we do, how we can prevent those conditions, how we can approach those situations. And in menopause, because 1 in 7 women will get a diagnosis of breast cancer. Every 3 glasses of or units of alcohol that one drinks, we increase our breast cancer risk by 15%. And then especially that's worse in menopause. And so there's no safe amount of alcohol to drink. And then after the 3 units, every glass that you drink, beyond the 3rd unit per week, you start increasing your risk by another 10%. So, it's really important to see what are the triggers for you. Trying to reduce things like alcohol, trying to see whether your sleep is disturbed because of caffeine, trying to see whether your sleep is disturbed, because we know that night shift workers, as they get older, have, higher risk of breast cancer, especially aggressive breast cancer, cigarette smoking. These are all things that can really make menopausal symptoms actually worse, not physically being active. So get up and move every 20 minutes or so. Try to go for a walk and doing strength training exercises, because you know that without doing weight-bearing exercises at least twice a week, and without keeping your bones healthy, we have a higher risk of hip fractures and falls. And then when you introduce dairy into those diets and eating cheese, and because your doctor thinks that your bones get stronger with dairy, which is the complete opposite, in fact, I think, from the way you look at the Western.
Yes, it actually showed that those with the highest amount of dairy actually have the
highest risk of hip fracture.
Hip fractures in women. Yes, which is
and also
so
I think
sad
vegans
that
do have a higher risk. Yeah, vegans also have a slightly higher risk of osteoporosis, I suppose, because they tend to be of lower weight. If you tend to be heavier, that's one situation where you have raised BMIs tend to protect you from osteoporosis because you're carrying more weight. But there are so many ways of making sure that you're eating plenty of soya, 2 to 4 portions. 1 portion of anything is a handful. So trying to have that, doing strength exercises, skipping, doing weight exercises, Pilates, yoga, body resistance exercises. These are all equally important, but diet is so important because you don't want all these calcium thieves, lots of sugar in your diet, lots of salt in your diet, lots of oil in your diet, lots of animal foods in your diet. Not a good way. The more you move towards eating whole foods, you tend to reap the benefits. And you can decide, do I do it straight away after listening to Linda's and Nitu's discussion, or do I do it over a period of weeks or months? It doesn't matter, but you need to know that it's okay to take a bit of time so that the gut microbiome changes along with the foods that you introduce. Otherwise, you'll say, oh my God, the beans give me bloating. So beans are the problem. And actually, it's the bacteria, the healthy bacteria are missing, and the bacteria that are there don't know how to digest fiber in the beans and things. So it's so important to understand that. And cooking your beans really well, rinsing them out, making them really soft. These are simple things that I talk about on my website. But Linda, I don't know if we can take some questions. Do we normally take questions?
Yes, so we do after the interview. We will finish because you're finishing at 6 in about 5 to 10 minutes. But I would like to shoot a few questions that came through before as well. So one of them is, it's about vaginal dryness. What can be done about it? Are there any practical things that they could do at home?
Yes. So there are several things you can do. We will talk about the important things that I discuss in my website on looking after your vagina and vulva, which means avoiding soaps, avoiding perfumed toiletries, using natural oil. So instead of eating your coconut oil, use your coconut oil on your vulva and vagina area on the outside, so you can massage the skin so it becomes nice and supple. You can get some vaginal moisturizers that do not have any harsh chemicals in them that you can use once or twice a week or just before intercourse. You can get some vaginal dilators, and they come in lovely colors nowadays, and you can get them and use them so that you are able to stretch the vagina slowly in your own privacy, rather than finding that it's really hard. Because one of the important things with vaginal atrophy, can get worse with time, and so people then get put off having intercourse. So if you're having penetrative vaginal intercourse, the more often you have it, actually more stretched or less uncomfortable the sex is. But if you start off by having pain, you tend not to want to. So that's why putting natural oils on the outside, avoiding soaps and perfume toiletries, using environmentally friendly sanitary wear, environmentally friendly underclothes, as well as laundry detergents. These things make a big difference, very big difference. Using some vaginal moisturizers. And then very important to know that local vaginal estrogen is safe. You can use it for the rest of your life. It's not HRT, and it can make a big difference to cystitis symptoms as well as vaginal changes. Because the reason why the skin starts getting thin, so I always say that when you start getting wrinkles on your face, you lose the wrinkles in your vagina. So basically, you want to be making sure that the vagina is plumped up with the estrogen. So not everybody needs it, but it is very safe and very useful for a lot of people, and can really, it's not hormone replacement, and you can use it twice a week after an initial course of about 2 weeks time, and your GP can prescribe it. There are some contraindications. Sometimes if you have particular types of breast cancer, you need your oncologist or your breast surgeon to agree. And then there are other laser treatment to the vagina which improves the collagen, that can work in that sort of situation for those who can't have vaginal estrogen. There's also other things like what is known as DHEAS, prasterone, pessaries, which also behave in the same way. So there's a lot of help available for vaginal atrophy. But interestingly, foods like soya, foods like watermelon and melon and things can actually improve vaginal lubrication and reduce discomfort during intercourse. They improve the blood supply.
I knew it can prevent diabetes and heart disease, but I didn't know this. Thank you.
Now you know that.
I will keep this in mind. Very important.
So lots of colorful fruits and soya.
And may I ask a little bit about hormonal therapy, because there's a lot of misinformation, and from an expert like you, it would be great to hear. Yeah. Should women consider hormonal therapy, and if so, when?
So if you are diagnosed with premature ovarian failure, then, which means under the age of 40, then you can, so say you're 20 or 30 or 15 or 38, and you're suffering from these symptoms, doesn't matter. Hormone replacement therapy of estrogen and progesterone is very important, and you can take it until you're 51. So if you are 30, you can take it for 21 years. If you're 40, you can take it for 11 years. At 51, you would then have a discussion with your doctor, but HRT is safe for, I have a lot of 90-year-olds who are still on HRT. Now, there is a slight increased risk of breast cancer and a very slight increased risk of ovarian cancer. Really, it's lifestyle. These are lifestyle-related cancers. So less than 2% of breast cancers are contributed by hormone replacement. So you really want to be remembering that is carrying excess weight, not exercising regularly, not eating a whole food plant-based diet. So adding mushrooms can reduce the risk of breast cancer. Adding green tea, adding soya, and adding flaxseed, and keeping a healthy body weight and exercising regularly can reduce the risk of breast cancer and also the cancer coming back. So HRT is safe, and if you need it at 45, you need it at 42, if you need it at 50, after the age of 60, if you have not taken HRT and your periods have stopped 5-7 years ago, it doesn't protect. There is no real evidence to suggest it increases the risk of dementia or heart disease, but it doesn't protect as well. So at 60, you should really be looking at as to why somebody's asking for HRT now, rather than 5 years ago or 10 years ago. But 10% of women or 12% of women will still be suffering with hormone, with hot flushes 10 years after they stop their periods. So it's important to know that while most people's hot flushes will settle in 2 to 4 years, and of course they may not even have that if they are following, a whole food plant-based way of eating. Some people actually can just sail through menopause, not for everybody. So you really should be open that just because you're doing all the lifestyle measures, if your quality of life is so bad, then you need to be on HRT. Now, HRT is in many forms. The best forms tend to be transdermal. So you would want to use estrogen as a gel or as a pump or as a patch. In some women, patch is not so good because sometimes it can cause erratic bleeding, but it's fine after the age of 55. And you need to have progesterone. So if you haven't had your uterus removed, you have to have progesterone either in the form of a Mirena coil or some sort of progesterone containing coil because it has to protect the lining for womb cancer. Estrogen can increase the risk, unopposed estrogen. So you want to have that, especially if you need contraception. Otherwise, you can take a vaginal pessary of utrogestan or microgenized progesterone. So rather than taking a tablet by mouth, you can, but rather than taking a tablet by mouth, you're better off having the gel and a vaginal pessary or an oral progesterone tablet. The gel bypasses the liver, the patch bypasses the liver. That is why we prefer that, especially if you have high blood pressure, especially if you're carrying excess weight, because there are some risks with HRT. However small, there are some risks. So you want to keep those risks to a minimum. Yeah, so I have a whole leaflet on my website that one can read on HRT, on menopause, perimenopause, what should you eat, a little, in the diet, a day of what you can eat over a day, what you can eat, and lots of recipes, loads of recipes that are all menopause friendly.
All of your website information, your new book, and the social will be added in the YouTube link below.
That's fine.
I would love to ask one more question about menopause and sex drive. It's a question that a lot of patients are hesitant to ask.
Yes.
So do you think menopause affects women's sex drive?
100%. So basically, because what happens is that all the sex hormones tend to drop, and its reduction in sex drive can start even in the perimenopause. So, and then on top of that is the social situation. If you're having a difficult relationship, if you're having elderly parents, if you have children leaving university, combined with your estrogen levels dropping. And so one of the things is if you have high estrogen levels, like in a typical Western diet, and then it suddenly crashes, that makes it even worse. So that is why we think Southeast Asian women, so people from Japan and Korea, Japan and China and all, don't have such intense hot flushes because of that drop is a little less. They have lower levels and then drop slightly. But sex or libido as such, or sexual desire can start waning even in the perimenopause, many years before you actually stop your periods. And on top of that, you add vaginal atrophy and all the social situations, and it becomes a problem. And testosterone hasn't really been shown to, and even hormone replacement doesn't really bring back libido, as I've observed in my 35 years of experience. It can help to some extent, but it's being aware that your libido is dropping. For some people, they may need the testosterone gel, which is off license. They may need that on top of hormone replacement, but it's not there's no guarantee. That is why you're better off doing little romantic weekends, using vaginal dilators, doing all the general vulval care measures so that you're not getting put off, and finding different ways to bring a sexual desire back. And also there's a freedom of pregnancy. So, and also, you're financially more secure and things. So sometimes it can actually work in a very good way. But biochemically, yes, we do find that sexual desire can drop.
Mm-hmm. A practical question about pap tests and mammograms after menopause. Should they or should they not continue with them?
Until the age of 64 or 65, whatever our national screening program is. After the age of 50, you need to have it every 5 years. If you, we are now doing primary HPV testing, and hopefully self-testing will come, because examination in the menopause can be very painful for a lot of people with atrophic changes. So, self-testing of HPV would be something that is very much looked forward to. The trials are already on. You have the IMPROVE trial in Amsterdam that is already, had a big pilot, and I think it's started. In London, we have the self-testing of HPV, but until 65, unless you have had a problem with your smear test, in which case a specialist will decide whether you need more regular smears at all. But having a yearly smear is not needed after the age of 50. At no point, you should always follow the NHS guidance. We only recommend yearly or more frequent smears if there is an indication. I see a lot of patients who go to have smears every year, and it's just not needed. It's not scientifically proven to act. It adds to anxiety and things like that.
And so if it's not every year, how often should they go?
As per the NHS. So from the ages of 25 to 50, you go every 3 years, unless you have a medical, unless there's a problem. And you can have the HPV vaccine up to the age of 45. But you have to have it privately, because on the NHS, you can have the HPV vaccine that protects against 70% of the cervical cancers. But that is available only until the age of 25. So beyond that, you have to go privately on the online pharmacy. And if you're suitable for it, then it's something to think about. But smear test between 50 and 64 is every 5 years, unless there's an indication. And after that, you don't need to have it again, unless there's an indication.
We talked a lot about diet, a whole food plant-based diet in particular, exercise, sleep, but there is one other industry that is attacking our patients.
Supplements.
That's supplements. Yes.
Throw all your supplements out.
This interview. It's supplements.
So let's all your supplements out.
Yeah.
Throw all your supplements out.
Yes.
There are very, very few supplements that you should take. There are a few, and I will say that, but the reason it's $1 billion industry is because of the fact that supplements promote themselves as natural. I just want to draw your attention. There's nothing natural when it goes into a tablet. So when somebody is asking you to take a soya tablet or soya isoflavones, yes, studies have been done, but you're having concentrated amounts of soya instead of having the tofu and the tempeh and the soya milk and the soya yogurt and the miso and the natto. So when you take soya tablets, I have seen women who have had postmenopausal bleeding, because it's like taking unopposed, high levels which are not regulated, because the natural food is so clever. It knows how to affect the beta receptors. It's got this impeded estrogen activity. When you extract certain things, it completely loses what it's meant to do. The same thing with black cohosh and St. John's wort, and there are so Agnes castor. These all can actually affect your other medications, can affect your liver. There is nothing natural about taking these medications. Focus on food, focus on beans. They actually will give you much better resource. But taking vitamin D, especially if you're a person of color, and taking vitamin D between 1,000 to 2,000 international units for a person of color, especially in winter months, is really important. Daily, with the largest meal of your day. Taking vitamin B12, if you're above the age of 50, is really important. You can take a spray, or you can have it twice a week. And after 65, I think you have to have it every day, 1,000 micrograms. So you want to take B12, you want to take vitamin D, and you want to take algae-derived omega-3. Now, algae-derived omega-3 is important, although you will get omega-3s in flaxseed, chia seed, walnuts, and it may be fine, because that might be all you need, and your body may be a very good converter. But in extremes of age, children and older people, we think that the conversion of ALA to DHA to the longer chain may not be as good. So taking anywhere between 300 to 1,000 milligrams of algae-derived omega-3. So this is the reason why a lot of people eat fish, because they get the omega-3. But remember, the fish is not making it themselves. The fish is eating the algae. And so you're not only eating the omega-3 that the fish makes, but also having the saturated fat in salmon. You're having, because these are all big fish especially, what happens is there is bioaccumulation of pesticides. There's persistent organic pollutants. There are plastic. There are antibiotics. There are all kinds. Most of the fish that we eat tend to be, drenched in antibiotics. So you want to have algae-derived omega-3, which is safe, and you should take that daily. Vitamin B12 and vitamin D. Anything else is not needed. All these things for joint pains, and you'll be amazed. Just have a green smoothie if you can, few times a week. Just have lots of fruit and beans and vegetables and whole grains and potatoes with skin and sweet potatoes and herbs and spices. And so instead of taking a turmeric tablet, instead of taking a garlic tablet, eat the real root, eat the real food, because that, again, there was a very good study, Linda, I will just quickly finish here, which showed that lung cancer patients really did very well when they were they did better when they were having carrots, for example. And so what did the pharmacy industry do? They took out the carotene. Yes, they took out the carotene from the carrots and gave it to these people. And actually they found that it displaced a lot of other healthy stuff, and they had a worse outcome. So just because something is in a tablet and is marketed as natural, be very wary of it. Every day I see a patient with menopause, they'll come with at least 10, 15 bottles, spending a fortune. Go have a nice massage, go have a pedicure or a manicure, go for a nice plant-based meal. There are beautiful restaurants all over the country now. Go support them. That's how you spend your money, not on supplements.
And what is a better way to eat natural? Is it if it actually looks natural?
Absolutely.
And we just have one question for you, and we'll let you go because we know you're very busy.
Yeah.
And Janet is coming live with us. Thank you, Janet, for joining us. Hi.
Oh, I got so many questions. I thought we were having half an hour of questions.
Sorry, today we are a little bit short today.
I would have answered most of your questions, Janet, and it's all on my website. Literally everything that you probably will ask is on my website, but go ahead. Let me see if I can answer a few of them.
I wanted to know specifically about these supplements that we should use, different brands, because you don't know which ones are good ones. Like the vitamin B12 I take in the veg one.
You just have to look online, look at the reviews, because as a doctor I shouldn't really be talking brands. I myself don't know brands. I just go online. I get some from the Vegan Society. I eat veg one, but generally speaking, I don't. I think if these companies are generally, they're all doing what they're meant to do. They're all monitored. I just don't want to take random supplements. I just don't. Iodine is another one, but that's present in the tablet that I take.
It's just been amazing. Thank you so much.
Any other questions?
Do you have any other questions, Janet?
No pressure. But the thing you said about fruit, you said if you eat one, eat two, eat three. Is there a maximum amount? Because I think my husband...
About 20 fruits. Maybe 20 fruits. Let's look at 20 fruits a day.
The problem is that probably has that many, and I wonder if it's too much.
So the important thing to remember is that you want to eat a very plant-based diet. So you don't want to have 10 portions of soya. You want to have 2 to 4 portions. You want to have 5 to 6 portions of fruit. You want to have 5 to 6 portions of vegetables. You want to include everything, all the health. So there is no upper limit. I mean, why would you want to eat 20 portions of soya? Because that's not going to bring you health, because you have to crowd something else out, correct? So it's just remembering that you're eating for health. So if you're eating 3, 4, 5 fruits and you're enjoying them, bowl of mango, satsumas, bananas, apples, pears, blueberries, strawberries, you've done it. Some days you might eat more, some days you might eat a bit less. Doesn't matter. Don't overthink anything. At least I am a lazy cook. I love cooking. I don't overthink health. I just enjoy life, because I think that is so important, that you want to be doing charity work, lots of communication with people, help a neighbor, do all these little things, go for walks, laugh, reduce your stress, avoid alcohol and smoking, and eat plants. If you can do that most of the time, yes, if somebody shows you a vegan pizza, tuck into it. I'm okay with that.
Thank you. Amazing.
Thank you so much, Janet. Thank you. And I would love to just ask you about your book that's coming out, and it's ready on pre-order, Living Purpose-Free. You have written it with your incredible daughter, Rohini. Could you tell us a little bit about that, and where can our listeners buy it?
So you can log on to my Instagram page or onto my website, and it'll take you straight into all the big bookstores, and you can pre-order it. The beauty about the book is that, there are a lot of people in the wellness space who try and account for any of the medical interventions. And while you have doctors who don't support lifestyle. And what this book does is shows you how you can regain your hormonal health and actually learn to manage your polycystic ovarian syndrome, which is the most common endocrine condition that affects women and affects them even in menopause. I have a whole chapter dedicated to menopause, but the whole book is actually not just for people with PCOS. It will help anybody who either knows somebody with PCOS or just wants to learn more about women's health. or men's health. So it's got lots of different chapters, lots of myth busting, but it's a wonderful, wonderful way, I think, that I have been able to reach out to people. And I've deliberately, Rohini and we've got lots of recipes in it. So recipes that will suit everybody. And lots of, lifestyle advice as well. Different things, it's not just food. And nobody's asking anybody to go vegan. It is all about eating for your health, eating for kindness, eating to really live the best way you can, living the best way you can. So I hope all of you will support the book. I've kept it without as cheap as possible, without colorful photographs and things, so that it can access all the people who most need it.
Thank you so much. Thank you for your amazing work, for your time. Blessings to you and your family. Thank you to all of our guests for joining us today. It was an incredible session. Once again, we learned so much. If you are watching on YouTube, then you will see all of the links to Dr. Bajekal, to her work, to her book, Instagram, and her daughters as well, Rohini Bajekal. Her interview is also on Afternoon Tea with Docs. If you want to learn more about PCOS, you can find it out in the next episode. So thank you very much.
Thank you, Linda. It's so always such an honor to come and speak to you. I love everything, as I said, you young doctors do. I love it. Thank you so much. And thank you for inviting me. And thank you everybody for tuning in on a Sunday. So that's amazing. God
Happy
bless.
Halloween.
Take
Bye.
care. Happy
Bye,
Diwali.
everyone. Thank you for your support. Thank you. Bye.
Bye.